Okay, so before we start doing any kind of therapy in regards to showing you what kind of modality to use for your shoulder pain, we're going to show you how we pause, because pausing for us is a kind of examination that tells me, the doctor, of what's going on with your body and how we are going to treat, what machine to do, what supplement to do, basically direction of the treatment of the chronic shoulder pain. So pausing, like we said before, it's a 5,000-year Chinese history pausing. So what I may do for you, because every time you're going to come to this room, okay, first, and then you're going to be sitting down on a chair, and I'll be touching your pulse right here, either this or this pulse. When I test the pulse, things will go through my mind, and analysis will go through my mind. I'm gonna explain the series of analysis that go through my mind in regards to treating the shoulder issue. Okay, so the very first thing, when I pause the shoulder, I will first of all see which structure has issue. For example, if I touch the shoulder, I have to determine which muscle. Is it a supraspinatus tendon? Is it a deltoid issue? Is it a infraspinatus muscle? Now, if it is a supraspinatus muscle, which is the most common injured muscle for the shoulder, which I show you already in the MRI, the report and also the film, the injury to the supraspinatus tendon. Okay. Now, if that is the issue, then I will pause the body to see what's going on with the structure. Is it a muscle issue? Is it a tendon issue? Is it a ligament issue? Is it a nerve issue surrounding the area? Is it a fascia? Is it a bursa issue? Or is it something to do with the lymphatic system, or is it a blood circulation issue? And pausing will tell me, first of all, which structure it is having issue for. So once I determine structure, for example, I determine it is a muscle injury. So then I go into deeper testing to see what kind of injury. Is it a tear injury? Is it a adhesion? Is it a spasm? Is it a movement of the muscles and tendon ligaments? That's how I do that. And the next category, because when I do pausing, I do categories. The second category is, I call it a chemical category. Now, chemical category, I will see if the muscle, for example, muscle of the supraspinatus is inflamed. Does it have involvement with the sugar issue, involvement with the toxicity issue? It could be that your cell structure is not doing well. It could be that this might be some bacterial infection, virus infection, fungal infection. There might be also pH issue, like we talked about in the previous slides. There might be alkaline, there might be acidity issue as well too. And I also check if there's any nutritional deficiency. If there is nutritional deficiency, then which nutrient is missing from the muscles? Is it calcium? Is it mineral? Is it amino acids? It's a lot of different nutrients might be missing from the muscle, and all that can be done with pausing. Okay, and the next category thing is the emotion, which I also mentioned before. If you have a certain emotion that is associated with the muscle, let's say, for example, if you have a lot of anger in your life, then your liver might be an issue associated with your shoulder. Then I take away the emotion issue of the anger that is trapped in the shoulder. And a lot of patients, quite a few number of patients, when they have shoulder pain, and we've done everything. We've done the modality to repair. We've done inflammation, take away all that, take away the inflammation and toxicity. They still have pain. Then we address the emotional issue. When the emotion or the stress is taken away, the shoulder pain, it's gone, almost immediate. Okay. And the next category is electromagnetic field. What that means is, people carry cell phone. We have patients that carry cell phone in their pocket. And every time they put cell phone in the pocket, they will have leg pain, and numbness will go all the way down. And once I found out that the cell phone is causing the physical issue, I tell them take it out, then right away, within 1 or 2 days, the pain, the numbness, tingling, it just went away. Same thing with the shoulder. If you're carrying cell phone all the time, beeper all the time, in your pocket or in your front pocket, it could be one of the reasons that may have caused your shoulder discomfort. Okay. Now all these are different layers. So we want to make sure that anything that may have caused a shoulder issue, may have interfered with the healing of the shoulder, we have to take them out layer by layer, one by one. Okay, there might be organ issue, there might be thyroid that may be associated, there might be a kidney associated with the shoulder, there might be heart associated with the shoulder. If there's an organ, we gotta we're gonna address the organ issue as well too. Okay, now organ, not only can we pause the organ issue, you can also do blood testing to determine what's going on with the organ issue as well. There might be certain allergy issue associated with the shoulder, allergies such as food. We talked about diet before. Food that may have caused inflammation such as sugar. If you eat too much sugar, you may have more pain. If you eat certain food, we talk about the nightshade vegetable, potato, tomato, black pepper may have caused it. For myself, when I eat mushroom, when I eat asparagus, my shoulder would pain that very night. Right away, and I will not be able to move my shoulder all the way up this way. I will not be able to. And if I don't take supplement to drain away the toxicity, the sugar, then the shoulder pain will stay with me for at least a month or maybe half a year if I do not take care of it. Okay, so that's a certain allergy. If you have an allergy with the food, then there is, other than the pulse testing, there's a blood test with IgG, IgE. There's also different food sensitivity tests with the blood test that you can do to get a complete overview of what kind of food that your body or your shoulder is allergic to. Once we take away the allergy to the shoulder, allergy of the shoulder to the diet, then once we treat, when the pain is gone, it's gone. It will not come back unless you keep on eating the wrong food, wrong diet. Okay. There might be also referral issues such as the shoulder pain could be coming from the neck. So I have to pause that as well. Is it coming from the neck? C1, is it from C3, C4, C5, C6? Or is it from the shoulder? Is it from the rib? When we pause that, we can tell. And when I touch the neck, then I can tell what's going on with the shoulder if it's referred from that area. Another one is the Chinese medicine theory, which I incorporate, such as the 5 elements of Chinese medicine: the fire, the wind, the water, the dampness. Is it because the blood clotting? Is it because the qi is not enough? Your yin-yang issue? All that could be causing the stagnation and accumulation of bad energy in the shoulder. And that need to be taken away as well too. Okay. Another issue is that we pause is the brain issue. We're gonna show you all the different ways to treat that. Of course, when we pause it, we need to determine if the muscle of the shoulder or the supraspinatus is coming from the brain. Could be the brain, the front, could be brain, the back, brain on the side. The pathway, we call it large diameter pathway. When the pathway is blocked, the signal from the brain cannot be sent down to the muscle. Therefore, the muscle will not have enough signals. Therefore, the function and repair is going to be very limited. So we got to open that channel, that large diameter afferent pathway channel as well too. Okay, and there's other little stuff which when you come here, I will pause for you to see what interferes the healing of his shoulder. Okay, so once I finish pausing, then I will determine what's going on with the shoulder, what kind of supplement you need to take, what kind of herbs you need to take, if you need to sleep better, if you need to sleep more, if you need to stop working, and then I will determine what kind of modality or machine that we're gonna do for you to repair the shoulders. Okay, so let's go ahead and go to another room. I'm going to show you different machines.